Let me see, what have I done with my slides? Hi, for everyone in the room who doesn't know me, my name's Katie Munday. I use they, them pronouns. I'm involved in a lot of community-based research and participatory action research, specifically the last 3 or 4 years on cancer services. Um, and I must be mad because I'm just starting my PhD as well. So I just wanted to talk about, I literally started my PhD 4, 5 weeks ago, um, having kind of published in this area before and been like, this has been a personal experience of mine being a trans autistic person, but also an academic interest of mine and a professional interest of mine. And it's kind of seeped into all areas of my life, as these things do for some of us. Um, so my PhD is called Exploring Health and Social Care Inequities for Transgender and Gender Diverse Autistic Adults Living in the UK. I've only done a few slides because otherwise I go down rabbit holes and I could be talking about any old nonsense. And I'll share these with Fergus for them to move them on to everyone afterwards if they want them. I've got to say that I'm an SCDT funded PhD because my funders will like that. And I'm down in University of Portsmouth. I'm very happy to say that I'm actually Stephen Capp's first um, first supervision, if that makes sense. So it's me and Stephen rolling down there to autistic ADHDers, just living our best lives down in Portsmouth. And my work is hopefully going to address the issues of inequity in health and social care for trans and gender diverse autistic adults. I've kept it very vague because it's going to be participatory action research. It's going to be me and other trans and gender diverse autistic people. And when I say trans and gender diverse, I mean like the biggest umbrella of trans that you can imagine, and also with autistic experiences as well. I think we really need to understand like the systemic issues which affect our ability to trust and engage in these services, which already exist for people if we're autistic. But then if you're trans and queer as well, obviously other things, other barriers pop up in healthcare for us and health and social care too. Um, Studies are going to take an intersectional approach that decolonizes neuro and gender normativity. I realize the irony and the pain and the excitement and anger and frustration that comes with working within academics as someone who 20, 30, 40, 50 years ago would not be able to set foot into academia for being autistic and mad and fat and trans and femme and um so it's a really interesting journey for me, as I'm sure it is for other autistic academics. Um, and hopefully this will enable the collection and sharing of experiences which are rich in diversity and authenticity. The kind of aims of my study is to collect and share stories of trans and gender diverse autistic adults, their experiences of accessing or trying to access health and social care in the UK to better understand inequity. So when I say health and social care, I've made it super broad because I want other people to, participants or attendees, to share what they want to say. And no point me going in there as one trans autistic person and saying, oh, we're going to specifically look at this. I want people to be able to say, oh, I really struggle with mental health, or I really struggle with my social workers, or I struggle with, or actually, I found that this is really good within substance use services, which is another thing I do work around with as well. So people will just lead the conversation, which is really, really exciting. I think research for me, that's exciting instead of me going in there with a gun ho idea of what we're going to talk about and what we're going to find out. Um, so it's with a mind to gather and co-create new evidence that facilitates an understanding of how to reduce or remove barriers and inequities for TDD autistic adults in the UK, and co-create resources to share with health and social care professionals. I feel like a lot of work is based around knowledge gathering, which is brilliant and fantastic, and absolutely that has to happen. But I'm kind of fed up with autism research, especially done by non-autistic people, about, oh, this is what we know about autistic people. or cis people going, this is what we know about trans people. Okay, so now what? What's going to happen? What's going to change? How is that affecting my life and the life of other autistic trans people? How do we actually get things set in motion? It's a pretty tall order for a PhD, but I'm bloody well going for it. I'm doing interviews with trans and gender diverse autistic adults, going to do focus groups to kind of then reanalyze what has been shared with us within a group to see how things overlap, but also to see any kind of outliers as well. And we're looking at things, we're not taking an appreciative inquiry approach, but I am looking at things that like, oh, what went well and how can we make that more consistent across health and social care as well? So I don't necessarily want it to be all doom and gloom, but also if that's how it goes as well, then that's how it goes, and that will be exceedingly useful as well. And then there will be focus groups with trans and gender diverse autistic adults who work or volunteer in health and social care to actually check the feasibility. Okay, so this is what we know about our experiences and our kind of wider experiences. If we want to change health and social care, how do we make it that this is actually something that can happen with health and social care? Having worked within this area for the last 4 or 5 years now, there's a lot of pushback on we don't have from healthcare professionals, not all of them, but some of them. We don't have time, we don't have the resources. The frameworks that we're working in are archaic. And I'm kind of fed up with people giving excuses. So if we can say, oh, this is what people probably need, and this is how it can actually be enacted, that's like takes out all the steps of making excuses as far as I'm concerned. So for all of these phases, there's going to be this kind of consistent analysis and reanalysis, a lot of reflexivity. I really like that as a person who, within my positionality, who is trans and autistic as well, about reflecting on my own experiences and how they are or aren't reflected within people I'm talking to. And hopefully this will grow to the in this kind of growing area of work aiming to improve health and social care for trans and gender diverse autistic adults, which is happening, and it's really exciting. And I think it's a really exciting time for me personally to be doing this, because the trans autistic overlap is higher than some might assume it is. So it's a growing kind of little niche going on within academics. So I'm hoping to be not on the ground floor of this, I don't think so, but early doors, which is lovely. I've shared some links of interest there, which I might put into the chat in a minute, but you'll get the slides either way.